Hi, I'm Alon Kaufman, CEO and co-founder of Duality, and with me we have Dr. Kinneret Livnat-Savitsky, managing partner of Team8 Health. Kinneret brings over 25 years of experience in the biopharm industry, helping grow companies and lead them to collaborations with big pharma companies, including IPOs. Welcome, pleasure to be with you.
Hi, thank you for inviting me.
One question, looking from the Duality angle is when you looked at these gaps and you look at this industry, where do you see the role of data collaboration in the space, and even maybe more specific, privacy-preserving data collaboration? Where do you see this playing a key factor here?
Medical data is extremely sensitive, and you need to manage it in the right way, because you want to make sure that you have patient trust on how you're going to share the data and how you're going to treat the data. On the one hand, of course, medical data is very sensitive and need to be well protected.
Probably the most sensitive data we have.
Absolutely. This is often also a regulatory requirement. It's a significant barrier to research. On the other hand, of course, research is fueled with data. The better data you have, the better results you should have.
I always like to look at it like there's many times a lot of data or getting more data. On the other hand, sometimes it's the diversity of data, and especially in healthcare, I think this need to connect genomic data with clinical data, even today wearable data, behavioral data, consumers this is it's a huge breadth of data, which do you think this can really impact and be a source for many of the new companies or maybe many of the new initiatives you want to lead?
So you need to think about how you're going to actually protect the data. Doing collaboration is a must, especially in our sector, since you have different players. You have the provider, you have the payers, you have the research organizations, and more. And genomic data especially is even more sensitive, since you need to make sure that you protect the patient privacy, especially if you link it with some phenotypic information, because you might reveal the patient identity.
So you've done your PhD in human genetics, and really I'm a big believer that genomics is a huge next frontier for our research and products. My PhD actually was around running combining and doing gene knockouts to try and understand different connections and causality in gene networks. But tell me a bit how you see the advancement of all this genetic research and how this impacts the new or the transformative healthcare world, and specifically in the context of connecting genomic data to other data sources.
So genetic data is very sensitive, especially if you link it together with phenotypic data.
Like GWAS, genome-wide association studies and those kinds of activities?
For example, if you link it, for example, with the disease stage or status, age of patient or so, you might reveal the patient identity. So it's something to bear in mind all the time. In addition, let's look what happened since the genome was published. And lots of the diseases that are simple genetic diseases with one gene that is involved, in a way, they were identified already, but the diseases with genomic background that are multi-genes, multifactorial, are left for additional research. And this is more complicated because you need the whole genome in order to start looking for SNP, for example, that are related with the disease, or other polymorphisms that are linked to this type of diseases. So it's more complicated, and you can collaborate with entities that have the capability of generating this, that have a great capacity of sequencing big sets of genes. And but the problem is, again, how we are going to change the data So you need some solution. It can be by decentralizing the data collection or the data exchange or encrypting the data.
Yeah, really interesting. Like in some sense, I think the regulatory world or the privacy world is behind in terms of treating genomic data or genetic data, because they still don't treat the actual genomic data as private information. But as you say, the minute you start linking it to clinical conditions or any kind of thing, you have to do this kind of alignment, and that's where the re-identification happens. And this ability to do it, I understand from you how it's critical for the advancement of the industry, and really these kind of technologies like Duality supports opens up these huge new opportunities of really linking this data and seeing what can be done.
Yes, and I think that, looking from my perspective in drug development, and there is no doubt that the clinical studies is the heavy lifting of the pharmaceuticals. From R&D perspective, again, it would be great if you can actually look at the blinded data while these studies are still up and running, and be able to evaluate what's going on there, because if you can stop a study in advance and not spend all the cost and enroll more patients that needed to be enrolled, this is if the results are bad. But what about if you see good results in the middle, which reduce the risk, which of course the risk that we are talking in clinical study is still very, very high. So you need somehow to be able to look at the data in a blinded manner. So today people are using interim results, which is a kind of a solution, but the problem is that if the results look promising, then you still need to pay some penalty, because opening the data, then of course the company needs to pay more eventually to complete the study. We need to understand also that doing an interim results requires a man in the loop, although an external group of people that will review the data. And if we can do it in a blinded manner, that no one needs to actually, open the blinding of the data, this can be a huge progress, I believe.
Yeah, that's a very interesting direction of really privacy preserving interim analysis. Makes a lot of sense. So talking about, like, when we look at the collaboration, you spoke specifically about genomics and connecting and the privacy angle of it. Collaboration sometimes in other areas, there's also a problem of really agreeing to even work on the data jointly, not necessarily because of a privacy, and also agreeing like on data schemas and so on. Where do you think the healthcare in general is in terms of this mature and ability to really, or desire to collaborate?
So I think that we are already seeing this type of collaboration between different entities in the healthcare sector. They understood that you need to see the full aspect of a patient. It's not enough to look at the patient only at the physician office or in the hospital. You need somehow to look in the real world setting, because there is some issues of seeing the patient is in his own
a normal environment and his behavior and so on. Yeah.
So this is a type of patient journey, and everyone wants to understand the full picture and the full view of the patient. If a patient let's say, is tolerated to a drug that he received, and he shouldn't actually stop taking the drug, he should maybe change the dose, maybe he should change to a different drug. So you want, in the end, to have a better treatment to the patient.
Yeah, this is really interesting. So I really get it. So like, ideally you want to, like, if we could, we would like to have a camera on the patient 24/7, what he's doing, what he's eating, when he's taking his drug, and how he's behaving and communicating. But obviously privacy now again becomes a huge challenge also technically. So that's a path you think going forward. Once companies like Duality can solve the privacy angle of this collaboration, you think this will have a dramatic interest and impact on the world?
Absolutely, and especially since some of the clinical studies, but not just clinical studies, and more remote monitoring is happening, more sensors. People can actually be at home and remote their progress, and if they are doing well, and if necessarily, they can get in touch with the physician. So this type of information started especially in the COVID-19 pandemic, but it's here to stay. Everything is going to be, more remote when it is possible.
Yeah, really interesting. This kind of full view of the patient and its journey. If we could break down these data silos between research centers and treatment centers and providers and payers and so on, how would this actually benefit the patient care?
A holistic view of the patient is really important, and you can do it by collaborations, and this can preventive medicine and also more personalized treatment to the patient.
Yeah, and as you said, like before, really have a visibility to the full patient journey across the trials and treatment and so on.
Yes.
Excellent.
Indeed. And if you can combine the multiple silos of data, this is of course great.
Yeah. So I think breaking down data silos sometimes within the pharma companies or within the centers and also between them is really, I think, one of the frontiers that will open up a huge set of possibilities.
And it's also more secure from patient perspective and privacy and all of this, So, for example, take a patient with a heart problem. His doctors can use his genomic information in order to tailor a treatment for him, which is of course better for the patient. During the time when the patient is released from the hospital, he can still monitor or track his performance and monitor his progress, and he can stay in touch with his physician. If needed, he can always go back to the hospital or go to the physician office for additional treatment.
Yeah. So nearly by definition, this personalized treatment and then monitoring what's happened when the patient are outside really creates some kind of interesting angles because that data reveals a lot of his private life information, which is not necessarily needed for the analysis. So like this shows another level of, in one hand, you want to use part of the data for this analysis. On the other hand, there's very private data there that you don't actually have to know. And really kind of combining what you need versus not seeing what you don't need is a critical part here.
Yeah, you're right, because sometimes you want to know some of the information, but not the entire information, and you want to keep the patient privacy. Yeah. So you need to do it in the right manner. Yeah. Not sure if by encryption or other tools, but you need to be able to ask some of the questions, but not to see the rest of the information.
And this is very like in this place where you try to collaborate in a privacy-preserving manner. Some of them are like aggregated analytics that are on larger populations, but what we're talking now is on the individual level. So you can't like add noise to that, or you can't do aggregated. This is on a specific person. So that's another level of challenge here that solutions like this can definitely deal with. Yeah, when I used to work in the financial crime kind of space, like when you steal a credit card of a person, it's a limit time where the credit card is valuable, until you cancel it, or it even invalidates over some time. Healthcare data has an amazing property, specifically genomic data, because you cannot change it, but the impact of it, we still don't even know what the impact is going to happen in 10 or 50 or 30 years. And moreover, it's not only your data, because you transfer some of it to your kids' data. So if someone sees my genomic data today, it impacts my kid's life in 20 years' time.
And you can predict what kind of diseases you're going to develop. Insurance companies, if they get this information, they might use it, in a bad way. So I'm not saying that they are going to do it, but potentially they can do it if this type of information is used to this direction. So it's very, very sensitive. And as you said, the genome was published like 20-something years ago, and still not enough was doing with the genomic data back then. But we do see a big advantage now when we have the new sequencing machines that can do genomes like so easily, and the price were dropping so significantly, so it became even easier to publish genomic data. So yes, you need to take good care of the genomic data.
I think this really takes this world of what we call responsible data analytics or responsible data collaboration to another level, both from the privacy side, but also from the ethics side. And it's a whole new domain that is opening up now, which the more digital companies in the space, I'm sure, have to address.
Yeah. And you need to find a way out to do it, because not doing it and not using the genomic data is wrong. But the question is how to do it and what kind of security you can or regulation you should have there in order to make sure that no one is using it in the wrong way.
No way, yeah, I'm excited about the future once we solve it from the medical side but also from the privacy side. This is a huge potential. Yeah. Thank you very much, Dr. Kinneret Livnat-Savitsky, sharing your passion and insights around really the power of data collaboration in the space. I'm really looking forward to see what's going to happen and what the companies you will build up in the Team8 Health Foundry. Really, thanks a lot for joining us. It was a pleasure.
Thank you. It was my pleasure.